GOHASH.in की टीम फैजुल्लाह खान और सादिक पहुंचे डीसी ऑफिस, जहां पर उन्होंने वीवी ज्योत्सना जी जो कि डिप्टी कमिश्नर हैं गुलबर्गा की, उनसे मुलाकात की। डीसी वीवी ज्योत्सना ने कहा शुरुआत में कि वो एनी टाइम अवेलेबल है लोगों के लिए और आप बगैर अपॉइंटमेंट के उनसे मुलाकात कर सकते हैं।
I'm going to ask.
Welcome to walk in at any time.
Yes, sir.
No, you don't need my appointment to come anytime.
ESIC हॉस्पिटल को क्यों कोविड सेंटर नहीं बनाया जा रहा, उस पर उन्होंने जवाब दिया कि ESIC हॉस्पिटल के अंदर ऑक्सीजन की फैसिलिटी नहीं है, उसके लिए ऑक्सीजन प्लांट वहां पर लगाना ज़रूरी है। और अजीम प्रेम जी फाउंडेशन प्रॉमिस किया है कि ESIC में वो जल्द से जल्द ऑक्सीजन प्लांट बिठाएंगे, जिसके लिए उन्होंने अब तक 3 हफ्ते की मोहलत मांगी है।
We can have 500 beds there, but there are very few oxygenated beds because ESIC does not have an oxygen plant. Oxygen needs to be stored in a plant and supplied. It is dependent on cylinders. So when you keep on changing the cylinders, what will happen is the pressure will drop and patients will not get oxygen at the required pressure. Ajim Premji Foundation has promised us to give an oxygen plant. We have been coordinating with them. Within 2-3 weeks, they are going to get an oxygen plant for ESIC. When it comes, we can increase oxygenated beds by 200 more in ESIC.
Saying that if you are coming to a hospital, bring your oxygen with patient. They are saying like that also.
They cannot say that.
People are saying continuously.
प्राइवेट हॉस्पिटल्स जो लोगों को ऑक्सीजन सिलेंडर लाने के लिए कह रहे हैं, उन्होंने कहा कि वो ऐसा नहीं कर सकते, उस पर इमीडिएटली एक्शन भी लिया जाएगा।
Even one person, 2 days ago, one person called me in midnight saying that one hospital is saying like that. Then I spoke to the administrator immediately. It said that it is not responsibility of the patient to get any supplies, oxygen or anything. It is the hospital's responsibility. It is public hospital or private hospital. When he is under your care, you can't give them prescription, make them run around for medicines. You can't ask them whether they have oxygen and all. No. When I ask them who is your supplier and how much oxygen you have, they are comfortable in oxygen.
Okay.
They just don't want to take additional burden. So for that, what we did is we are maintaining an emergency stock of oxygen. And any hospital which says that they don't have enough oxygen, they can come to this emergency stock. Every day 1 or 2 hospitals are picking up. They don't have to ask the patients to get oxygen. Hospital can always come to us and take extra oxygen. In fact, to streamline all this, we have taken control of all the 4 oxygen plants that are there in Gulbarga. And we have put a Tahsildar level officer at every place. And round the clock there is a team which monitors how much is getting produced, where it is going, and which hospital. And we also cross-check. We call at the hospital and see we have dispatched 20 cylinders from here. Did you receive those things? Or someone is trying to divert them somewhere like this. We are monitoring.
हेलो एवरीबॉडी, मैं हूं फैजुल्लाह खान और आप लोग देख रहे हैं GOHASH। तो फिलहाल काफ़ी दिनों के बाद डीसी मैम के पास हमें टाइम मिल चुका है, तो वीवी ज्योत्सना जी मैम जो है मेरे साथ मौजूद हैं।
जिम्स हॉस्पिटल के ICU बेड्स कब सेटअप होंगे?
Expansion of GIMS, we are creating 65 bed ICU, which will be ready in this week. In fact, all the equipment has come and we wanted to start it, but again some oxygen related issues were there. If I connect these 65 beds, the oxygen pressure will come down in the entire hospital. Then all the patients already in GIMS are going to face a problem. That's why we had to hold it and get some technical person and tweak in such a way that it does not adversely affect the existing setup in GIMS.
ऑक्सीजन प्लांट जो सीज हुए हैं हाल ही में और एडमिनिस्ट्रेशन के अंदर हैं, किस तरह से वो अब काम कर रहे हैं?
So we have taken over. We have seized that plant under Disaster Management Act. We have taken it over. And I have put under the control of the Gulbarga AC, and we have put a Tahsildar level officer there to monitor. And one thing what we found is after putting our people and after taking over that plant, there is a tremendous increase in the production itself. Earlier, they were showing around 300-350 cylinders. Now every day my AC gives me a report. They are producing. They are able to produce with 570 cylinders, 550 cylinders. It's like we are getting additional 250 cylinders. So that's why last 1 week, the distress calls have come down. The pressure is still there. We don't dare to say that we are in a comfortable zone. The pressure is still there, but it's definitely is easing because the production is increasing.
उन्होंने कहा कि डॉक्टर्स और हॉस्पिटल पे कोई हार्म नहीं कर सकता और वो डॉक्टर्स और नर्सेस के बिल्कुल हित में है।
I will not let any harm come to the doctors. I will not let any damage happen to the hospitals. It's not about individual grief. It's about entire district's grief. It's about everyone's tragedy. So we need to protect doctors and that. At the same time,
जिम्स हॉस्पिटल के अंदर मिसमैनेजमेंट चल रहा है, किस तरह से उसे ठीक किया जाएगा, उस पर डीसी ज्योत्सना ने क्या कहा?
there are complaints about mismanagement at the hospitals. Either it could be about food or it could be about the care and all that. Never before healthcare setup has come under so much pressure.
Yes,
Never before doctors were forced to do 2 shifts in a day. Never before the nurses were put there for a longer time. Everyone is stressed. Everyone is tired. Everyone is frustrated. And day in and day out, when they see that, the mental pressure that they go through is tremendous. But at the same time, we need to keep training them, motivating them, and say that there are certain things which are, not negotiable. You can't compromise on those things. That is care when someone comes here. And also, there were issues about the food also. The menu or the regularity with which they are giving. When these issues have come to my knowledge and all that, I have put KAS officers, AC level KAS officers at every hospital. One officer at GIMS, one officer at ESI, and one officer for private sector. What they have to do is see the bed allotment, whether it is happening transparently or not.
Yes.
And second thing is whether the duty roster is being maintained.
Yes.
Whether the doctors as per the roster are coming, whether the nurses are attending to the duties as per roster. And all these non-clinical issues also, the regularity of food and all that, they are giving us reports. And today with NIC also, we were trying to build a setup where all the hospitals and their CCTV footage to be displayed here in DC office.
So
from all the
you will
hospitals.
see that visuals and what they are doing negligible, so you can take action on them.
We can clearly see.
Yes.
Whether doctor has gone there or not, we can't go into the COVID care wards.
Yes.
Okay, no one can enter that except for medical care people.
Ma'am, what are the preparations, because cases are increasing day by day, because उस पर कोई चीज़ की लगाम नहीं है, केसेस कंटिन्यू बढ़ते जा रहे हैं मैम. सो क्या एडमिनिस्ट्रेशन की तरफ से, मतलब केसेस अगर बढ़ रहे हैं तो कोई चीज़ें एक्सपैंड कर रहे हैं क्या, जैसे फंक्शनल हॉल्स ले रहे हैं बढ़ाने के लिए, बेड्स वगैरह, और कुछ क्लेरिफाई कीजिए ना.
बेड्स बढ़ाने का तरीका तो एक है फंक्शन हॉल्स और हॉस्टल्स में बेड्स डालने का, बट देयर कांट बी एन ऑक्सीजन सपोर्ट देयर.
ओके.
Now I already have 1,000 beds in different COVID care centers across taluks and also in the city, which are just lying around, because without oxygen that bed capacity is meaningless.
Okay, isn't it?
Because even in hospitals, ESIC has almost 200 beds vacant because it doesn't have oxygen support there. So mindlessly putting beds in function halls doesn't serve a purpose. It was different. It is different from first wave. First wave, everyone was in hospitals.
Yes.
Even asymptomatic cases, mild cases were in hospitals. Then we needed this kind of general beds, opening up hostels and putting beds in function halls. That served that wave. But this wave we don't need general beds. We need oxygenated beds.
कर्नाटका हेल्थ मिनिस्टर जो कि हाल ही में विजिट किए थे, उन्होंने कहा कि 1000 ऑक्सीजन कॉन्सेंट्रेटर्स वो देंगे गुलबर्गा डिस्ट्रिक्ट को, जिस पर वी ज्योत्सना जी ने कहा कि अगर उन्हें इस तरह की मदद मिल सकती है गवर्नमेंट से तो वो इमीडिएटली जो कोविड सेंटर शादी खाने में हो रहने दो या फिर जिम्स के बाजू हॉस्टल में या अलग अलग एरियाज में ऑक्सीजनेटेड बेड्स वो बना सकती हैं.
We do have one big hostel complex next to GIMS, which we were trying to convert into GIMS Annex. About 200-300 patients can be treated there. The same thing, we have put beds and we have got teams and all that there, but no patient can be treated there because those patients who can be treated at general beds can be treated at home. That is the thing. We are trying to procure oxygen concentrators. Oxygen concentrators do not depend on liquid oxygen supply.
Okay.
So if we can get the supplies on time, we can put them in those beds and convert them into oxygenated beds. That will get maybe 200 to 300 additional based on the oxygen concentrator supply. But unfortunately, all the supply chains are broken. There is no manufacturing happening in India, and even something comes from outside, like even I have placed orders also, but I couldn't get access to them. Like there is no distribution happening. But we did get an assurance from government of Karnataka the other day when Honorable Minister for Health visited us. He promised us that he will give us 1,000 oxygen concentrators when they were procured. And they have already placed orders. So if they come, then our peripheries, especially the taluk level and rural area hospitals, can be completely oxygenated.
Okay.
And then all this, the function halls GDA function hall where we have put beds and made all arrangements. And also this hostel complex next to GIMS can be converted into oxygenated beds. Right now we have 1,000 general beds which were not occupied. The lockdown guidelines allowed weddings up to 50 in function halls. But now that is not being allowed. It is only up to 40 with prior permission and passes given by the tahsildars. And this can be performed only in the houses where that wedding is happening. We know that it will have livelihood ramifications. We don't want to go so harsh on people, but at the same time, when people's life and death issues are there, we'll have to take some stringent measures. So we are closing the commercial establishments also. The second wave is much bigger than what we have seen in the first wave. It's not just in Kalburgi. It was there across India, across our state, and across the world. Across the world, healthcare setup is under tremendous pressure. That's why when we say that, the beds are not available, when we are talking about this one, in this second wave, what we are seeing is people are turning critical in very few hours. In the morning, they have a saturation of 96, and by evening, it is dropping to 50, 60. What we lack is implementation. That responsibility from people. Even you were there when we have done this Mask Pehno campaign.
Yes.
When we get into the bus, when we see from the road, we see that everyone is not wearing a mask.
Exactly.
The moment we stop a bus and get into that bus, within that 2 minute span, everyone's mask is on.
Yes.
So everyone has a mask, everyone knows to put on a mask, but no one does that. It is not about awareness. It is about, owning up that responsibility and all that. And there are two things in, door to door. One thing is we'll be establishing a lot of contact. It will be like a super spreader event. Yes. So what we are going for is, auto miking in vehicles. You have seen corporation announcing, and the same thing announcements from auto and bikes are happening in rural areas also. Remdesivir is for treatment. एक बार आपको कोविड हो जाता है, तब आपको treat करने के लिए, not for everyone.
Yes.
There is only a specific kind of seriousness which requires remdesivir. Remdesivir is not a vaccine. Vaccine, like before you got COVID, when you are proper healthy, you take a vaccine so that it is a preventive care. Okay. You will not get COVID. Even if you get COVID, it will not turn into a severe disease where you lose your life. So the person who takes vaccine can get infected, but it will be only mild to moderate cases. It will not turn very severe. Recently also there was one issue happened in Aland Taluk Hospital. So I went to the hospital there. I put additional police force there, and I also talk to the doctors, and I have to give them assurance that I'll take care of everything. Okay. You take care of clinical issues. Okay. You take care of the patients. We'll take care of everything else. And recently there is an issue in GIMS also, and there is one issue in SADIQ. So everywhere, because this is, the crisis that we are seeing is unprecedented. The human tragedy that we are facing is unprecedented, not just here, across the world. Everyone is frustrated, everyone is in fear, everyone is losing their loved ones. So we need, but at the same time, my doctors can't be touched. Hospitals have to be protected. Because today a person who is in grief, he attacks a doctor or attacks a hospital, there are 10 other patients there. Yes. Who will go into distress.
Yes.
The doctors who are treating them are already treating them under, at a lot of risk.
Okay.
Every day, a lot of my doctors and a lot of my nurses, they are turning positive, and some of the doctors are also dying.
Yes. Is it?
They are taking a lot of risk and treating, and above that, they can't even face this kind of law and order issues. Positive. And RT-PCR used to be very dependable test, but now in the second wave, because of the mutations or all this, many times it's not getting even detected in RT-PCR. So the people who are not showing any symptoms, or people who are showing symptoms but turning negative, are in fact COVID positive patients. The test is not coming positive. So because of all these reasons, the distress is setting very fast, much faster than what we have seen. And earlier days, in first wave, even the mild cases, asymptomatic cases used to be admitted in hospitals, or even the primary contacts, secondary contacts used to be put in quarantine centers. Now the protocols are not like that. As long as your symptoms are mild and you are not going into distress, you can get the treatment in home isolation itself.
Okay.
But now the kind of cases that we are getting are all critical cases, oxygen dependent cases. One of the critical gaps is that we have 1604 beds right now dedicated for COVID care in the district, in Gulbarga district, and 704, something like that, 767 as on today, are HDU beds. HDU and ICU put together. HDU means oxygenated beds, where you will be given oxygen and HFNC and all that, and ICU beds. Put together, we call them as critical care for a general understanding. So we have only 767 critical care beds. When people are saying that there are no beds, it's not it's not that there isn't a cot or there isn't a mattress. That means that the bed which can give you that critical care, the access to oxygen or ICU or ventilator, we are running out of that. And we can't even create them overnight, because critical care is not about infrastructure, it's not about a bed.
Yes.
It is about the human resources, it is about access to the oxygen and all this. This is something which cannot be built overnight. We were trying really hard to expand our bed capacity also. In GIMS, for example, we have a new ICU building which is under construction. So we finished it off very fast.